So, with my professional development, the first question we're going to talk about is which setting do I envision myself practicing? Heading into PT school, I had shadowing, typically at an outpatient orthopedic clinic, besides one specialty hospital. I was during my gap year, I was a technician for core physical therapy in Chevy Chase, and then I just completed my rotation for this PT 837 at Star Physical Therapy here in Donaldson, outside of Nashville. Um, and after experiencing once a day in acute setting, and now that I had all of this ortho background, I feel pretty confident now saying that I will see myself in the outpatient orthopedic setting. Now, having been exposed to some of the other areas, but leading to my next potential setting being the neuro outpatient setting. We have 1 or 2 days in Cardinal Hill of experience with patients in the neuro realm, but I had a particular case here on my PT 837 journey here in Nashville where we had a patient suffering from monoplasia due to a pretty catastrophic snowboarding incident, and we had to just put her in the right hands of care because we were not able to get accomplished what we were hoping we would be able to with her in our clinic, and to see kind of some of her struggles, some of the internal factors, the anxiety, some of the depression. It really motivated me to really want to help her. And I feel like once I'm able to be in that neuro setting with that experience, I will be able to provide that help. And who knows, it could see myself there as well. Some of the short-term, long-term goals for my practice. A short-term goal that I had consisted of coming back from this clinical with a newfound confidence that needs, emphasized on needs, to be translated into the classroom. I struggled a bit with the academia component of this program up to this point, but after having this hands-on experience and having this hands-on practice, which typically I see myself being more successful when I can apply content, I saw some of that growth. I saw some of my inner confidence build, and found success with some of that hands-on application. But the job is not done. Ultimately, hopefully all of that newfound success and confidence will aim me towards graduating from UK's physical therapy program in August of 2024. I'll be, after my experience in the clinic, I realized how important it is to stay on top of literature and how beneficial some of that information can come into play in your each day while you're there. So I would like for short term, I'll be an avid user of UK's database for research before it's stripped from me with graduating from this program. But this kind of segues nicely with time to starting my first long-term goal of maintaining an APTA membership for the sake of having access to the current literature and databases and staying up to date, through the various newsletters that they could send. UK has a ginormous free database, which has been great, and it will be very missed once we graduate, but cannot neglect the benefit of having access to data plentiful, at our hands for growth in this profession, and that's what APTA can offer. And additionally, for the continuing education courses, the discount of taking with these courses by being a member of the APTA can be extremely cost effective. It was interesting while I was down here on my clinical, my CI was completing her COMT certification, but this was through the company's expense. So this was a conversation we had, but this was something that I was unaware of, and that, she told me about how companies, if you go out and apply for continuing education, certain certifications, they, typically, not always, but could just agree to it and then pay for everything. So I'm making it another long-term goal to ask for this type of information, during future interviews, so I can start to plan, thinking about what I just talked about. Witnessing my CI 10 years into the field now, strive for her second specialty certification, and she's certified Mackenzie certified, and now COMT. It kind of just, seeing that laid the groundwork for me to see what I can strive to be even still out of school, and not losing that drive to continue to grow.